vaccine literacy, patient counseling, and promoting safe vaccine practices. Pharmacists need to do more, and it is our task collectively to see how we can advocate that pharmacists get into this more and more, because ultimately it is the community-based vaccination as well as advocacy that is going to be our strength, because we have huge numbers, and these huge numbers, we are around 1.7 million, that is 17 lakhs pharmacists in the country, out of which I think more than half, maybe 1.1 million, that is 11 lakhs are working either as community pharmacies, hospital pharmacies, or clinical pharmacies. So these are huge numbers, and we can definitely uh, do a lot of things with this. Now, we were also very lucky, privileged, fortunate to have FIP backing us, and along with IPA and FIP are running a vaccination training program for pharmacists, where pharmacists are being trained as vaccinators. Otherwise, officially, there is pharmacists have never been trained as vaccinators in our country. So this project has initiated that, and under this project, initially over the last 2 years, we have trained 85 vaccination trainers in different parts of the country. And these trainers, in turn, we are expecting them to train more pharmacists in their institutions and in their vicinity. So this process has begun, and these trainers have already started training additional pharmacists. And the lead was taken in the KLE College of Pharmacy, Belgaum, and the Vikas Institute of Pharmaceutical Sciences, Rajahmundry, and we are slowly moving into other areas of the country. Now, as we train more and more pharmacists nationwide, we will have larger numbers, and we will have then the access, because pharmacists as accessible immunization champions with their widespread presence and trusted status can definitely do a lot. We can definitely help the government to improve vaccine uptake. There is a lot of misinformation about vaccinations, so we need to strengthen this and counter this misinformation. And there are a lot of children who have, and adults also, who still have a lot of vaccination missing. We need to be helping them to catch up these vaccines. We sincerely believe in partnership with the government, and of course, the private sector has a huge role to play along with the government in expanding the immunization reach. So already a lot of hospitals, clinics, private clinics, and pharmacies, diagnostic chains, and vaccine manufacturers, all of these can largely contribute to the vaccine infrastructure in our country. There is large scope for increasing the technology, not only for manufacture, but also in improving the supply chains and creating awareness and new delivery models. Another important aspect, which will of course again be covered in this session, is the zero dose children amongst the undeserved population. That is, a lot of children still have not been vaccinated. So these are the zero dose children. And we at IPA are working towards bringing to the attention of everybody. There are several pockets in our country where children are still unvaccinated. There's a lot of reasons for that: socioeconomic barriers, geographical isolation, conflicts, or a lot of misinformation where there is vaccine hesitancy. And so there is a need for collaborative working and strategies to close these gaps. So IPA is strongly working towards this, and we foresee that pharmacists in the country will slowly have a huge role to play in this. And coming towards the end, we would like to highlight that antimicrobial resistance and vaccines. So vaccination has done tremendous to reduce infections, and that in turn, as we know, vaccinated individuals have reduced risk of infections, and this in turn reduces the need for antimicrobials. So by working in this way, we hope that preventing infections will reduce the misuse of antimicrobials, and this in turn we will support the country's plan for containment of AMR. The country, uh, through the Ministry of Health, the ICMR is working very strongly against AMR. So we need to strengthen their hands. And so for this particular week, that is we are fusing the overlapping activities: the National Pharmacy Week, third week of November, and the World Antimicrobial week, which is ending on tomorrow. So both are overlapping activities and both have similar themes. So this is one of the activities of IPA's uh, antimicrobial stewardship program. So we look forward to have multi-stakeholder collaborations, and we would like to here again re-emphasize on 3 points: elimination of zero-dose status children, promoting adult vaccination, and combating antimicrobial resistance. Now, this will require coordinated action between the government and professional bodies across all professions. And of course, IPA would like to be a very important player in this, besides other private providers and community influencers. With this, I have given you a brief overview, and I welcome you all once again, and we look forward to a very fruitful webinar moving forward. Thank you.
Next up, we have Dr. Sumalatha, who is the Principal and Professor of Vikas Institute of Pharmaceutical Sciences, and also the Chairperson of Education Division in the Pharmaceutical Association, and she will brief us about the synergy of collaboration for community engagement. Over to you, ma'am.
Yeah, good morning, everyone. Actually, there is some network issues. Since it is Sunday, I'm at home, so we have some power fluctuations. So that's why I cannot open my video. I'm sorry for that one. Am I audible?
Yes, ma'am, perfectly fine.
Am I audible?
Yes, you're audible, ma'am.
Yeah. But I have very low voice, even I mean because of charging problem and everything. But anyway,
Okay.
the uh, topic and theme which was given to me uh, regarding that one, uh, we as a part of IPA-SF and Indian Pharmaceutical Association, both ED and CPD. So we are all into it. So we are collaborating with the community service. So we have adopted 5 villages in and around our campus. So we are doing regularly medical camps and awareness camps, and uh, you name anything. So it is regard to women health. We are giving awareness programs and trainings to all the women in and out nearby these 5 villages, and we are giving them a proper information regarding their even menstrual hygiene and children hygiene and everything, and surroundings, how to keep neat and tidy all the environment, and how the communicable diseases are getting into the thing in that village. So everything we are giving awareness, and we are training them, and we are making them to understand all the things which is happening because of the disease and all these things, inflammations and all these things. Apart from that one, we are collaborated with so many, nearly 10 to 15 schools in and around, and every month IPSF team and we teachers will go there and will train the students regarding the malnutrition and hand wash and hygiene and everything, and we are making them understand what is the pharmacy and what is the science and what are the things they need to understand regarding the medicines or dosage forms or something like that. And recently, as a part of this National Pharmacy Week, as well as antimicrobial resistant stewardship, we have conducted a few competitions at the campus level, and also we have conducted medical camps nearly 5 villages, and and as well we identified few points which is notable uh, pertaining to this medical camp. So one is we understand there is a lot of communication gap in the patients because they don't understand what are the medical instructions which were given by the physician, or otherwise they could not explain their symptoms very clearly to the physician. And second thing we observed, like there are misconceptions about the health issues. People believe that health problems are only because of age, and they don't seek any timely medical attention because they think that this is because of age they are getting all these health issues. And another point is neglecting the follow ups. This is the main issue. Once they are fine, they don't go for regular health checkups and they are not continuing the treatment whichever is needed for the disease. And another point is inadequate patient counseling. Patients, of course, they don't have time to listen from the pharmacist or the physician, or they don't pay attention in taking the guidance, or otherwise they are not on having a knowledge on the medication use, disease management, and the follow-ups. This also leading to so many issues in the patients, and they are and the next point is about the misusing of the painkillers. Unnecessarily, very frequently, the people are using painkillers without any medical supervision. It has become a common thing to all the patients which we observed in these medical camps. And of course, they have a misconception about the antibiotic. So there is no awareness regarding this antibiotic resistance. So that's why whenever they need, they are using the antibiotic and they don't understand the resistance and also misuse of these antibiotics. And one more problem, limited access to healthcare. Maybe this is because of the distance problem or lack of emergency care hinder, or because of proper treatment, or maybe because of financial constraints. So there is a limited access to the healthcare in that particular villages. And few people are really about self medication. They are really frequently relying on the self medication and also home remedies. And the only pharmacist is advising them without consulting the doctors. This is also one more problem we identified during this medical camp. And another point is poor medication adherence. So the people, they are not continuously following up with the prescribed regimen. They stop using medicines when the symptoms are improving, or if they are feeling better, they're stopping uses of the medicines. So it is also one more problem or challenge we need to address. And and the last thing is they don't have an awareness about the disease. This is also main concern. Many patients doesn't understand their condition, the severity of the disease, or how to manage it. Because of the uh, lack of disease awareness, also there are so many issues in the patients. So these are the few things which we observed during this medical camp. And regarding the competitions, all the students participated very well. And in this camps itself, we have given after completion of their uh, OP. So our pharmacist students, they counsel the patients, all the patients regarding the AMR, and also few about zero dose children and also adult immunization even. So as Raj sir rightly mentioned, eh, either it is IPA-SF or it is IPA Rajahmundry local branch or IPA CPD, IPA ED or Vikas, anyone. So we all should collaboratively work together and looking forward for creating awareness regarding the zero dose vaccination of the children, and we have to promote the adult vaccination, and at the same time we have to create the awareness among the public regarding antimicrobial resistance. So I think these are the three things, as sir and Sunita ma'am mentioned, we have to take up these three challenges and we have to look forward and work collaboratively to achieve all these goals. And thank you for giving me this opportunity. And I mean, as you all aware, recently, from last 1 year, we are collaborated with even Dr. Karthik also. He is also playing a major role in enlightening the students and making awareness of mainly IPSF and PharmD students at our institution, basically. and he is giving lot of inputs to the students and is building network among the students. So they are showing little enthusiasm in working. So I observe this change in our students when he joined in our institute. So I think such kind of networking is very much essential, not only to the students but even for us. So simple thing is even Sunita ma'am and me connected because of Karthik only. So like this, uh, we all should have a strong network and strong collaboration with all other healthcare professionals so that we can achieve. I mean, we cannot achieve in a one work. So if you are a team, definitely we can achieve something in a better way. So I think this is my thing in today's session. And thank you very much for giving me this opportunity, everyone.
Thank you so much, ma'am. That was truly insightful. So moving on to the next one. So I'm MV Komali, currently serving as president of IPA-SF National Council, and I'll quickly share about how IPA-SF is contributing and being a part of this vaccination journey of advocating vaccination in India as a pharmacist. So I'll quickly share my screen. Hmm. Can you see my screen?
Just visible, Komali. Please go ahead.
Okay, okay. So the IPSF Students Forum, uh, as we all know about IPA, it's a national body which represents millions of pharmacists, which has five main divisions: industrial, community, educational, regulatory, and hospital. And it's a non-governmental organization which has affiliations with, which has international affiliations as well. And IPA Students Forum, it's a leading national advocacy organization which is a part of IPA under the IPA Education Division, and we promote students and we take up them as potential leaders, and they are our main support. Being in a national council, our student chapters are the ones who execute all kinds of activities that they can from their end for any kind of advocacy in healthcare sector. So this was when our students forum had formed initially. So this was under the this was during this was in Mumbai on 16th of August 2008, and in this year we celebrate 18 years of formation of IPA-SF. So this was just a quick shout out for how the legacy of IPA-SF that is being going on. So this is the current national, myself as the president, Rushali as the immediate past president, Rajalakshmi, who's also on the call here, is the secretary, Rohit is the joint secretary, Freddy Alapattu, even he's on the call, he's the treasurer. Akanksha and Kashish are the chairperson of public relations. Rajiv and Sharvari are chairperson of projects. Jameer and Mallikarjun are chairperson of liaisons, and amongst them, Mallikarjun is here again on the call. So, IPSF's activities or role in contributing to advocacy of vaccination, under the leadership of Rushali Doshi, last year we had conducted a awareness session with in collaboration with Serum Institute of India for the HPV vaccination awareness. So this collaboration was a step, you could say a small step to to increase the awareness of the HPV vaccination, on who all can take it and what is the age group and what kinds of HPV vaccinations are available. So to sum up the contribution of, voluntary contribution of IPSF to the ongoing project of FIP IPA vaccination project under the leadership of Ms. Mansi Doshi and Dr. Raj Vaidya. So we had volunteered for several activities, several vaccination programs. Those was that were organized. First one was in Bangalore in 2023 December. Second one was in Mumbai 2024, and following up with that, we had the Indian trainers training the Indian pharmacists, faculty, and students. So the first one was in KLE College of Pharmacy, Belgaum. And the second one was in Vikas Institute of Pharmaceutical Sciences, Rajahmundry, under the leadership of Sumalatha ma'am. So these are a few pictures of the Students Forum contributing for, supporting it in the ways that we can. So now during the National Pharmacy Week, we had a few, not few, many events that the student chapters had conducted across the nation. So these are just the glimpses, and we are still awaiting many more inputs to come because the week has just wrapped up yesterday. So we are awaiting for all the reports that we might get. But meanwhile, we had ASN college, ASN chapter, who had organized a series of events or who had conducted series of campaigns and competitions in their colleges and as awareness campaigns outside in the villages and the areas nearby. Next, we have IPA-SF Nashik branch, who had organized certain events in the college, such as ad design challenge, article writings, and furthermore. And we have IPSF Telangana State Chapter, who had organized a few web session and also infographics challenge. So the pictures that you see on the top are the the blood donation camp and the medical camp, which were from ASN College. Next, we have again series of events from Vikas Institute of Pharmaceutical Sciences as well. Medical camps were conducted. Certain competitions were organized in the college itself. So you see the pictures on the right hand side are the ones which are from the camps organized by the chapter, and on the left you see certain colleges from the Kerala State Chapter, those who have organized certain competitions, and they will be sending their reports soon. So just to quickly wrap up, our organization is affiliated to, again, international associations and organizations. We are a part of even FIPEC, Early Career Pharmaceutical Group, as a early career pharmaceutical organization. So we have IPA Students Congress, and please stay tuned for the 14th Student Congress. And these are the places where IPA Students Forum is already established, and we are looking forward to expand it more and include as many students as possible for better advocacy and for better for being the youth force for certain projects that the esteemed guests who are present on this call are leading it, and we are truly happy to be a part of all these projects that is initiated and are having a vision, and we are truly privileged to be a part of it, and we are looking forward to take in more students so that it will be more impactful. So this is just about the 18 years of impact that IPSF has, and yes, thank you. With that, I would quickly, without any delay, I would quickly pass on to Dr. Karthik Rakkam sir and Dr. Ambika ma'am. Yes, it's over to you, sir and ma'am.
Yeah. Because I think I will, and then you can take over. So even as ma'am said, I am also in a place where I have less access to internet. So I was saving my data to show my face when my turn comes. So I wanted to start by saying like how all of it started. So Ambika just sent me a message saying, "Sir, why don't we host a webinar?" So initially I gave up. I said, "So it is too short notice. So it will be difficult to put all these things together and host." But I said, "Let us give it a try." And I asked her to connect with both like Raj sir and Sunita ma'am. So she connected with Sunita ma'am, and Sunita ma'am said, "Let us do this because it is relevant to the theme and like timing is perfect." So now like 3 or 4 of us are interested. We wanted more partners who can support. ma'am reached out to education division and also student forum. Within like few hours, all of this uh, was possible, and today we are seeing each other and talking. The reason I'm saying this is if people come together with single point agenda, things can happen. You don't have to like wait for years or decades to make it happen. So this webinar is like example of that. I am going to talk. The topic says power of goodwill because I have done so many things only because of this goodwill, not completely because of knowledge, understanding, etc. Okay, so my initial interaction with IPA was through CPD, Manjini ma'am and Raj sir. Then I got in touch with Sunita ma'am through one of the IPA events. So I always say I remember IPA for that reason. It got me in touch with most important people who are in this call. And then later I got in touch with Sunita ma'am and through Sunita ma'am, education division. And most recently with few students, I was associated through student forum. But again, I am very happy to meet Komali. We had a lengthy call yesterday. So Sunita ma'am, we broke our record. So later I will tell you. So we got to understand each other. The reason I am telling this is before we venture into any professional activities, it is good to know each other as a person, the things we matter to us. So all of this aligns and we create something. It is not just two strangers come together and straight away take something and execute. So this is the second point I wanted to talk. And third one is a adult vaccination project which we started at Hyderabad. So I wanted to talk little about that and how it happened. So I'll share my screen and show also photos. And it all happened only because of goodwill. If you have to like ask me, sir, how did this happen? It is purely because of goodwill and nothing. So can you see my screen? So if we
Yes,
have
we
to
can.
implement this vaccination program, it has to ideally happen in a hospital setting. It can happen in diagnostic, it can happen in pharmacy, etc. But there are better chances if it happens in a hospital setting. So we were like happy to partner with Rainbow Hospital. Rainbow Hospital has a branch in Rajahmundry also. This person is Dr. Neeraj. So he's Vice President Rainbow and he's in charge of expansions of Rainbow. So I got in touch with him through one of my students, Yashoda Krishna. That is a different story, how Yashoda Krishna got me in touch with Neeraj. And once I got in touch with Neeraj, so he was contemplating this idea of starting adult vaccination program. So if you see the photo, this is the launch. We launched another photo. So we took one important stakeholder, the hospital, into confidence. So the hospital is ready. Next, we need somebody who should be able to manage that vaccination center. So I was looking for that, and around like same time, so I got a message from Dr. Samrin. She's in the call. She was doing some great work, but she was little disappointed that she was not getting a platform to implement so many things she had in mind. So I said she will be the right person to be part of this project. So I did not take her interview. So I know already about her passion, her interest, her capability. I made her an offer because I believe in a 15-minute interview, I can know nothing about that candidate. Most of the times, I just make an offer. I don't ask them any questions. I only find out if they understood the expectation from them. This is where it started. And later, I got in touch with the business aspects of this project. Okay, so most of the time in the academic circles, we talk about patient outcome, etc., etc. But once you go into business setting, all of that really does not matter. Many hospitals have told me that. So we wanted to launch it in a way it creates a lot of buzz. Luckily, Rainbow could do an event. So this is the event we launched at I think Park Hyatt in Hyderabad. And it was attended by the chairman and founder of Rainbow Hospital. And we had participation from all the major vaccine providers like Serum Institute of India, GSK, Pfizer. So all those guys were part of this inauguration. To see and like Ambika and Samrin were they played an active role in making this happen. So Pfizer was part of it, GSK was part of it. If you can see the right side of the photo, MSD, Reddy, Serum Institute of India. So I slowly, this is little transition for me from academics into the business world, where all these things also matter. The kind of brand you create, the name you keep, the place where you launch this program, the people who matter should come and attend and speak about its importance. We had a great panel discussion where so much discussion happened. And one thing I still remember is a doctor saying when we say vaccination, like everybody thinks it is for children. So he gave an example of an ad, like dairy milk. Generally, when we say chocolates, again, we think chocolates are for children. But this guy was giving an example of a marketing strategy where now adults started like eating dairy milk. They give it as a gift to girlfriend or boyfriend or so for whatever reason. So chocolate has gone over from just being a item which is consumed by children, but it can also be like used for adults. And so many doctors talked about the limitations and so many reasons why adult vaccination is not picking up. So this is the launch. You can see that photo. And then in business again, the important aspect is not just doing it one place, scaling it and sustaining it. So we could sustain and expand it. Like thanks to Ambika and Samreen who performed exceptionally well at one center, we could establish one more center in Bangalore. So this is a real photo of how the center looks in Bangalore. Even all these things matter. We can just keep like a SIM card selling kiosk, an umbrella, and make some person sit there and do the same work. But we can do it much more elegantly by like carefully designing the space, the aesthetic, the look, its visibility. So we make sure once the patient enters, it is at a place where it attracts them, it makes them interested to come and walk in and understand what this place is about. And then we have a person who is properly trained there, talking to the patient, addressing all their concerns, telling them the need for vaccination, recommending the vaccination, making sure the vaccine is administered, and then following up with the patient to see if they are developing any vaccine related ADRs. So we did it one place. So basically, we expanded it or we scaled to a different location, a different state from like Andhra Pradesh to Karnataka. But again, so we wanted to scale it to more places. And for that, as I said, I don't have any like business background, business idea. So I partnered with another person. So if I have to scale, I need somebody who understands business. Uh, so can you see all the photos which I'm sharing? So the photo you see again on my, I don't know which side, wearing the bag is Mahesh. So he has an MBA from ISB. So he's creating a business plan and business model for me. Me, Ambika, and Mahesh had so many meetings together, and we are creating a plan. Okay, so I have some goodwill. Mahesh understands business, but we need somebody to put money. So again, on the right, you can see this guy wearing this t-shirt and Krishna. He expressed interest to invest, and all these people came together only because of the goodwill I have with them, not because of any other reason. Okay. And finally, we started pitching it to more centers. So I had a center in mind. It's an oncology center. And I feel the need for vaccination is more in such centers where people are immunocompromised. In infection, it is very difficult to manage. So we did a presentation. So this guy again faces because if I go and approach it is not easy for a big oncology center to open their doors for us. And luckily, this person Zia works there as a clinical pharmacist, and I have very good will with him. So I said, we have a concept. Can we come and present it for you? So he agreed for it, and we made a presentation. And again, as I said, I was not there. Even Mahesh was not there on that day. So we requested if Amrita could go on our behalf. So instead of saying, "Sir, I will not do it. I'm just a fresher. I don't have a lot of experience." Took this challenge and she made a presentation there, and it was like very well appreciated. They called me later. He said, "Did an excellent job, and the hospital is interested to consider this." So now we are making a pitch purely in business sense, not saying it will improve patient outcome, it will reduce the resistance. All that is fine. But in a way, the hospital feels like accepting this and taking it forward. So if you are successful, this will be our center beyond Rainbow. So I will stop here. So finally, what I wanted to tell is, if you want to make it happen, it will happen. All it needs is right people coming together, and for right people to come together, the relation you have with them matters. Over to you, Ambika. You can. And I want also to acknowledge, like Sumalatha ma'am, thanks for acknowledging the like efforts which I'm taking and supporting the college. But it is also two ways. It is not just one person. So I wanted to give something, but there should be somebody who is ready to take it. So when I offered it to ma'am, so ma'am was took it, and not just take it, but gave me support in all the aspects. And in medical camps, one last thing. Recently, I was talking to a doctor, and this doctor said, just because you have a solution, it does not mean hospitals have that problem. Okay. So it should happen other way around. You understand their problems, and then you propose a solution for them. So that is exactly we accomplished during these medical camps. We wanted to understand what the patients are looking for, what they are lacking, what they truly need. So Sunita ma'am, what Sumalatha ma'am shared is the summary of what we understood. So we can start creating solutions for those 10 things which we noticed during the camps. We created a foundation for that. And we also took an official permission, which we will get very soon from DMHO, to officially provide certain services for five PHCs. That is going to happen very soon. We wrote them a letter. We have a verbal approval. Once we have a written approval with his seal, we are going to implement all the services in all the PHCs because colleges are. And tomorrow we are hosting Mahesh at this college. As I said, extending support is easy, but to make it happen, it takes an effort. So I asked ma'am, Mahesh is close by, he's in Guntur for some reason. Can we host him at our college? So she straight away said, invite him. He will be coming here, and he will address the students. Ambika, over to you.
Thank you, sir. Thank you for creating a platform where we could expand this project, not just one center, beyond one center to one state to multiple states now. So to introduce myself, I'm Dr. Ambika, Adult Vaccination Advisor, working at Avenida in collaboration with Rainbow Children's Hospital. So we have implemented our pilot project at Rainbow. We started with one particular unit, which Sir has already shown. So importance of adult vaccination right now in India is because of increasing antimicrobial resistance being one point. And second thing, there's a larger distribution of elderly population. Slowly, we are moving from children to elderly population. It is estimated that by 2050, we'll have more than 70% of elderly people compared to children. So when we think of vaccination, as we all know, we associate it with childhood vaccination. Nobody is really aware of what adult immunization is. And we all are often affected by influenza, causing missed work days, and also leading to hospitalizations. When it comes to pneumonia, it is one of the deadly diseases in our nation, especially in elderly and diabetics. And there's another disease named shingles, which is caused due to reactivation of chickenpox virus, that is the varicella, affecting the quality of life of most elderly, that is above 50 years of age. And it has led to increase in suicidal rates in India. And HPV is a largely known preventable virus associated group of diseases right now. And there is little better awareness compared to other vaccines for HPV. And hepatitis B, it continues to be the silent transmitter. So there's a gap that exists not because vaccines are not available. They are available. There is accessibility, but there is lack of awareness not just among public. It is also among the healthcare professionals. That is what we have noticed through KAP that we have done. So speaking about our project, the main parts of this project are we screening and seeing the eligibility of the patient. So every individual has a different set of regimen. It's not the same applicable regimen for everybody. We tailor an individualized regimen based on certain factors like age, comorbidities, pregnancy status if it is a woman, lifestyle and occupational risks, and also immunosuppression. And then we recommend a personalized vaccination regimen, and we counsel on vaccines, the most common ones being influenza, pneumococcal, HPV, Tdap, Shingrix, hepatitis B and A. So when it comes to counseling, being a pharmacist, we keep it very simple and give a clear explanation. When it comes to scientific knowledge, it can be found everywhere. Now that we have AI, I think everybody can surf it on the web. So we just don't educate them. We listen to the patient with empathy first, and then we understand what kind of education they need, and then we stratify the risk and benefit, the risk of the disease and what is the benefit of getting vaccinated. We also talk about the safety profile of the vaccine, because the most hesitancy comes because of vaccine safety, the vaccine side effects, and also fear of injection. We also speak about expected post vaccination reactions, most commonly being pain, induration at the site of administration, fever, sometimes vasovagal syncope. And then we reassure the patient and provide evidence based guidance. And being a pharmacist, we know how important it is to remind the patient so that they be adherent to the regimen. So we do maintain a separate vaccination document, as well as share a vaccination record with the patient, which mimics like a passport that we use for international travel. All the efforts made by Rainbow and Avenida to provide such document, and we make reminder calls. As of now, it's all manual. We are working on the automated system. We always follow up the patient for their second dose or third dose if there's any multi-dose regimen vaccine being given to the patient. So we can implement this project in a broader space. To take this nationwide, we need to integrate the system into multiple hospitals. We can have multiple adult vaccination desks, as this is whole a collaborative effort. It's not just one pharmacist educating, it's the doctor prescribing, it's the nurse administering. And also, as Raj Vaidya sir has spoken in the beginning, pharmacists are being trained as vaccinators. So more vaccinators are required in this particular setup. And we do have certain screening checklists. And right now, we have other adult vaccination advisors in the meeting, Dr. Saida Sambreen, Dr. Brunda, Dr. Dipanvita, and Dr. Ankama. They're all making great efforts in integrating this into multiple setups, not beyond Hyderabad. So we are also looking for community partnerships. We have done certain webinars and seminars at corporates. We tried reaching out to certain resident welfare association and a 3-tier and 2-tier schools right now. So we are focusing more on community camps and scaling it through awareness webinars. So we have just started this off. All thanks to Dr. Karthik sir and Sunita ma'am for giving this opportunity to speak about this topic in this particular session. So that together we can normalize adult vaccination slowly, like we did for childhood immunization. And when we speak of adult vaccination, it shouldn't just be a medical practice. I believe it is a public health responsibility to build herd immunity. So with this, I would like to wrap up. Thank you. Thanks for the opportunity.
Thank you so much, ma'am. It was truly insightful, and it's truly motivating on how Avenida Innovations is working on this in collaboration with Rainbow Hospitals. And yes, adult vaccination is something that must be addressed. And as rightly said, 2050 will be the year, or as the statistics of populations, that is when it clicked to me. Oh yes, India was in the phase where at a phase where children were the were the highest population, and now that they will slowly, those children will transcend into adults. So yes, adult vaccination is something that we must look upon, as well as while addressing zero dose children as well. Thank you so much, ma'am. Over to Sunita, ma'am, for the next key session.
Thanks, Komali. And a very warm welcome to all of you. It was really nice to see the numbers climbing. At one point, it was hovering around 59. And then when I got back to this big screen of mine to see only my slide, it was at 65. So those of you who joined late, thank you for coming to this session. I'm just, humor is very important. If you don't smile and start what you're doing, then it all gets very serious and we don't like what we are doing. I think what is extremely important is all of you who are here in this forum are either current leaders or future leaders, or in the cusp of those two, right? So there can't be a better forum than this, because when the current leaders and the future leaders come into one space, that becomes the most energizing space, because that is where all the valence electrons are all combining, and it becomes a very nice space for any kind of synergy. On the chat, I had given you a link. It's a link which within 2 minutes tells you leadership is a hyped thing. The very important thing is who is the first follower. So when you get a chance, do watch that. And Komali, if we can play that at some point, it'll be great. But being respectful of everybody's time, I'm starting when I should have stopped. So I need my 10 minutes, and I will, gratefully ask for my 10 minutes attention from all of you. Now, I will not bore you with the theory. There is a lot of theory that I've put in the slides, and we can go through that, but I will not bore you with the theory. Whatever I am telling you now comes from the practical public health experience, where the zero dose project is what I finished in July this year, and technically in July, but practically in November this year, which was for Gavi, Global Alliance for Vaccine Initiative. I was the project director under Sabin Vaccine Institute. And for 18 months, my job was to look at all the evidence that has been produced by Gavi and to synthesize that evidence, so that when Gavi goes into 6.0, how are they then going to take that and move on? So that's what we did at Sabin Vaccine Institute. And it was a collaboration between Sabin as the primary institute and 3 other organizations based in South Africa, Cameroon, and Pakistan. So that, and working with Gavi, of course, because they were partners rather than just funders of the project. So this comes from practical experience. There is no theory involved here. The second one is the antimicrobial stewardship. From 2015, when South Africa introduced antimicrobial stewardship into its guidelines, and at that point, I was still a professor in Rhodes University. That's when I initiated my research and my teaching in antimicrobial stewardship. After I came to India, I needed a little bit of buffering phase. And from 2019, I initiated that in Karuna Trust, which is one of the NGOs. And right now, I'll be finishing off this project next month, which was a Pfizer funding to look at antimicrobial stewardship in 6 primary healthcare centers. So we are working with the 6 primary healthcare centers, where we're looking at what are the antibiotics that they use, the antibiogram. For the first time, the urine samples were collected from far away, remote places, like tribal villages we are talking of, where ashas have to go on foot to collect the urine samples. We have tested the samples when women have UTI symptoms, done the cultural sensitivity, found a lot of sterile pyuria. So now we are going for the multiplex PCR in the last 5 weeks of this project. And whatever I'm telling comes from that practical experience of 3 years, and there is no theory and not just academics attached to it. So please remember that these are the 2 merging synergies, which is bad news for India. Now, why is it bad news? Komali was just telling, all the kids now will transition to become adults. Yes, but what we have to bear in mind is, right now, India is the oldest country. We are one of a civilization. We were not formed 500 years ago. As a civilization, we have come a long way, but now we are the youngest country in the world because we have the highest number of youth population in the world. So when we have this population, this is the golden era for India. And for me, when all of you who are the mentees and who are the future leaders who are in this meeting, when you take the time and trouble on a Sunday afternoon, instead of thinking of biryani and sleeping longer and watching movies back to back, if you think, all right, let me go and see what is going on in this, I think it is worth your time. That's what you have done. You have invested your time for the betterment of society, for your own betterment, and for a sense of purpose that you want to lead in your leadership positions. So please bear in mind that India is in that golden phase with respect to the highest number of youth, people below 35 years of age. If at this time we can break even from all the shackles we have had in the past, geopolitically, we have been in a very bad place of being ruled by different people. Becoming 2047, the Viksit Bharat will become a child's play. Why? Because if you don't have good health, there is no way you're going to be a Viksit Bharat. Please remember that. Those of you who are in your 20s, if you can maintain your health in such a way that you do not become sick because of all the lifestyle issues, living in the cities, all of that, that is the best investment you can have on yourself. So, two investments here. One is zero dose children. Why are we worrying about zero dose children? We are worrying because India stands second highest in the world. India has an excellent program with Indradhanush. India is doing everything that it can do at the Ministry of Health level. But what we forget is reproduction is also supposed to be responsible. So when responsible reproduction is not met with what needs to happen in a healthcare system, every single day we produce 65,000 plus children in this country. Every single day we are producing 65,000 plus children in this country. It is so easy to leave out a few million in terms of not being able to vaccinate them. Why do we leave them out? Because of different reasons, and I'll tell you about it. So if you look at it, though the number of zero dose children is coming down in India on one side, the sheer pressure of what we are putting on the public sector to do everything that it has to do. And one of the statistics is only 14% of India goes into the private sector for vaccinating their children. The rest of the people are going into the public sector because it is free. Everything is given free of cost. So when that pressure is put on the public sector, it is not a fair place. On top of it, with vaccine hesitancy, parents are not ready to vaccinate their children for several reasons. So all of this puts pressure. Now, where are these children sitting in the world? There are about 14 million children. Generally, they are in conflict zones, and I'll come later. It will be in the rural meaning very difficult to reach places, and in the urban slums, etc. There are also multi-dose children, not so much in India, but in the world, where what happens is they are not born in a healthcare facility. Their mothers are not receiving postnatal care. The children have not received their DTP1, and they have not received their vitamin A supplementation. When all the four don't happen, they are called multi-zero dose children. Fortunately, in the rest of the world, 55.6% of the children are not multi-zero dose. There is some connection with the healthcare facility, and there is some way it will happen. But let's come to India. We are very fortunate that we have an excellent community health worker force called as Ashas. There are more than 1 lakh Ashas in our country. They do the door-to-door visits. We also have Anganwadi centers from the Ministry of Health. So this is the final unit for the public sector where a lot of work happens, and another 1 lakh people working there. These 2 lakh people, generally women, the third set of people in the front line are the primary healthcare officers. They are the ones that the Ashas report to. They also do a lot of door-to-door surveys. So put together between these three sets of women, we have the best kind of health system functioning at the ground level. And that is the big advantage that we have. And we want to make sure as pharmacists, pharmacy leaders, pharmacy future leaders, we support these three primary healthcare system people. Now, let's look at why do we end up with zero dose. I will not spend a lot of time here. Mother's agency and mobility is the only place where I will spend time. The reason is, if we can get it right with the mothers, we get it right with the children. If we get it right with the mother and children, we get it right in the family. Let's make that bottom line very clear, especially in a patriarchy. So this is not me saying, this is research. I had to synthesize 180 abstracts at one point for Gavi. One of the things that came through very strongly in India is, when a father says the girl baby can be immunized, but the boy baby should not be immunized because they have heard that they become impotent. When the mother goes and immunizes the child and the child comes down with fever and is crying the whole night, gender violence starts, domestic violence starts in the house. The father starts thrashing the mother because he says, first of all, why did you immunize the male child? Secondly, the child is crying, so the child has become sick. We are not supplying paracetamol or telling the mother the child will have fever, please give the paracetamol. We are not even doing that. We just immunize and send away. Obviously, what happens? Things that you don't think of happens at home. So what happens behind closed doors affects what happens when the doors open. So please bear in mind, if we can get it right in convincing the mothers and supporting the mothers to vaccinate their children, half our problems will disappear. And the other structural barriers, etc., I won't get into it. I just wanted you to be aware that they're all there, and that's what triggers everything.
Ma'am,
Causes
sorry to
and
interrupt.
consequences. Yes,
Sorry to
Komali.
interrupt. Ma'am, we are not able to see the slide completely because of that black block.
Sorry.
Would you?
Now?
Yes, now it's fine. Yes.
Yes, thank you. Now we are looking at what are the causes and consequences. So rural and remote areas, I told you before, when mothers especially are poor, they lack awareness, inadequate healthcare systems, this is what happens. What are the consequences? Why are we giving vaccines? These are for vaccine preventable diseases. If we can prevent the vaccine preventable diseases, then it will link up very quickly to AMR, and I will come there. When we don't vaccinate our children, what are we doing? We are exposing them to life-threatening diseases such as measles, diarrhea, pneumonia, etc. So when that happens, morbidity, mortality increases. When all of this increases, what happens? Infectious diseases start to spread. When we don't pay attention to children and zero-dose children, what are we doing? We are just leading to widespread outbreaks. So take a look at what happened when polio was around. Take a look at what happened when other diseases, smallpox was around, right? So where did we go from the elimination to the eradication? Now measles is in that place, and now DTP is being used as a marker vaccine to talk to us about it. Okay, so now we looked at one problem, which is pushing where we are with respect to our children and making not being able to make sure that they have a good childhood. They have less diseases. They are more into playing, learning, just enjoying their childhood. Let's look at AMR. AMR affects everyone across, whether it is an infant, whether it is a geriatric, whether it's a pregnant woman. There are no barriers with AMR. When we saw pandemics, the pandemic we went through, that was open. We could see what was going wrong. AMR is a silent pandemic. The damage is being done. We are not seeing it. So I don't have to tell to pharmacists what is AMR. I should not be telling it, and I will not tell it. But I will talk about zero-dose children contributing to AMR. When children are not vaccinated, what happens? They are more susceptible to infections. What happens then? You have to treat them. What happens? You have to use antibiotics. What happens with excess use of antibiotics? AMR happens. So it is that which is triggering the AMR from one side. Now, high resistant infections, we should always be very careful. Tuberculosis, India stands number 1 in the world for new cases of TB, right? So we know it is there, but how much do we do about it is a question we want to ask. And that's where IPA-SF has to start playing a key role in looking at what are the top challenges in India. What do we need to do to make sure awareness starts happening? With awareness, how do we connect it to action? So like Dr. Karthik rightly said, academics is one part, learning it is one part. But what is effective in hospitals is the other part. But for me, it goes beyond that. It is public health. It is about where money matters, yes, because somebody has to give the money. It's also about where public health matters. It's like how people say agriculture in India contributes only to 15% of GDP. We should be absolute fools to be talking like that. If there is no agriculture, there is no food on the table, where will your GDP come from if people are starving and dying? I mean, somebody should have some sense when they speak that. You cannot take agriculture and compare it with some rare earth elements from which you will make tons of money because you're sending children and people into the mining industry. And we know what happens to the people who are mining, right? We make the money. The rich ones make the money. What happens to the poor ones is the question. But we are not challenging those statistics. We get carried away by telling agriculture only brings 50% GDP to India. All right, stop agriculture. No need of food. Now get your GDP up and running. Try it. Somebody has to bring in those kind of thinking into the whole game and stop looking at only the number game. Zero dose and AMR is a bad double burden, double trouble to have in this country. We are the most populated country. If children are not getting vaccinated, those infections will start spreading to other children in the family, in the communities. Outbreaks will start. AMR is also to do with infectious diseases. The resistant infections mean, again, spread, outbreaks, etc. So we are asking for trouble. Now, AMR, please remember, only about 30% of antimicrobials we produce are used in human health. 70% of antimicrobials we produce is going into our food chain. It is going into the milk industry, meat industry, and agriculture. So whether you like it or not, whatever we are consuming is laced with antimicrobials. It is laced with chemicals, pesticides, herbicides, weedicide. We are killing so many things. We are forgetting all those chemicals are going into our body because the produce is coming to us. What we are doing is we are putting antibiotics and antimicrobials into the meat and milk industry and agriculture. What we are forgetting is 70% of antimicrobials are entering the food chain, right? So we better be careful, or you better be careful. You have another 60 to 80 years to go on with life. So you better be careful as to, where are we messing up in the name of money? Money is important. After a point, you cannot buy life and health with money. What we do is disease management, not healthcare, and let us be aware of that also. This will be a major problem that India will face if we do not pick up the window of opportunity we have now. This is the golden period. The next 5 years to 7 years is the golden period where we can make some difference. If we don't, please remember, both are systemic equity issues. The more poor people we have, the more migrants we have, the more underserved communities we have, and we think, oh, it's somebody's problem, it's a government's problem, it's a public sector's problem. It becomes everybody's problem. When TB comes and becomes MDR TB, it is nobody's problem. Public sector, private sector, whichever sector, there is only one-way ticket there. So we have to bear that in mind. What is it that we can do? We can talk about the problems till we go blue in the face, but we should do something. First and foremost, as pharmacists, we should join the public sector to look at immunization campaigns. So Mission Indradhanush is well supported. Ashas are well supported. Anganwadi centers are well supported. That's one thing I would really, really request the IPA-SF to take up. Second thing is awareness campaigns, the kind that Dr. Sumalatha and Dr. Karthik have now done in Rajahmundry. We need those medical camps to talk about these double burden of diseases and why we need to worry about it. This is not an academic exercise. This is a practical exercise. Most important is collaboration. We cannot do it all alone. We need people to be a part of this. So whether it is IPA-SF, IPA CPD, IPA ED, all of us are required. So we need more people wearing a few hats and not one hat. Most important, when you know your why, you will know your how. You don't have to worry about how to do something. If you first understand, why am I doing this? And like someone I like says, why the hell am I doing this? Then I think we get it. I see the smile, Komali. The conclusion is the way forward. So in the way forward, it's a dual challenge. We need to address it. We need to address it together. There are critical actions that are required. There's an end goal in mind. if we can't keep our children safe, how are we going to keep the future of India safe, right? If we can't keep the young population safe, how will we make use of this demographic dividend that we have? If all that demographic dividend that we see for the next 20 years, please do not forget, we will have the highest number of geriatrics in the country. Don't forget that. We have the highest young people now, but in 25, 30 years, that shift is going to happen. You will have the highest number of elderly in the country, right? You will have problems Japan is facing now. So you will be paying a lot of insurance for others to get their benefits. So remember, youngsters, it's time to work, and please work with us. We are here. You have excellent mentors on this program happening right now. Just join hands. We have no time to think and have a checklist. Is this good for me? Is this bad for me? Nothing is bad for you, and everything is good for you that you do under IPA-SF. So with that, Komali, I hand it back to you. I'm capable of speaking for longer, but I know I should stop now because patience will run out for people.
Thank you so much, ma'am. That was truly insightful, and you shed upon light on various topics and you had linked zero dose and AMR, which we were not kind of aware about it, how it would, no one would have even thought about it actually to link it. So yes, we have many, what do you say, challenges and projects and many issues to tackle, and yes, we must know our why to uh, to actually take it up or to actually contribute to this particular aspect of disease management. Yes, and thank you so much, ma'am. It was a really good session. It's open to a question answer session if the participants. Yes, ma'am.
I will start your question answer session by telling the minute we say question and answer, people think, we can't ask question to experts. First of all, no one is an expert. We just have more experience. Some of us have it for 3 decades. That doesn't make us experts. We just were born before you were born. That's all. All right. So there is respect for it, but you don't have to have it as a barrier. Comments. I would like to hear the young people speak up. Even if you have to say one thing that is a takeaway from here, or one thing that you will do after having attended. I can't believe from 65 we dropped to 61 in a minute. But share it on the chat box. If you feel, I don't want to talk, I don't want to come onto the camera, fine. We all have a choice. But put it on the chat box. It is very important we hear from you in some way, and then we hear from you by telling, how do we take it forward? So I'll stop there. Komali, it's all yours.
Thank you, ma'am. I think the students or the participants would be much free to ask their questions now. So all the questions are welcome. If we have, we'll just wait for 2 minutes and we can wrap up the session after that. So whoever has any questions or any insights or any points to put forward, you can put forward in the chat box, or you can direct it to personally to either the experts or the admin as well.
We are still 63 people.
Yes.
Everyone is smart here. So something has to come up on that message, everyone. My eyes are there and nothing is happening. So please, surprise yourself. Don't worry about us. We will be pleasantly surprised with whatever you do. What is the takeaway for you? You don't have to ask questions. Question time is silence time. We are not getting into the golden zone. All of us are hungry, so we should go. We shouldn't stop lunchtime. So biryani is waiting for some of you. So don't stop.
We have one question, ma'am. So
Yeah.
Dhanaji sir, Suryavanshi sir is asking, it is possible to open the vaccination center in each of my district? Oh, he has come up with his contribution, I would say. It is possible to open the vaccination center in each of my district.
Karthik, you want to take that?
Yeah, it's possible, but I wanted to understand which few others. So it's definitely possible.
I think sir is from Maharashtra, if I'm not wrong.
From Pune.
It's possible in each district in a whole in India. It's possible because we want to educate our pharmacists for vaccination. It is possible, and it is easy to us to vaccinate adults and as well as children's.
Yeah, it is definitely like possible. And as sir was saying, like IPA with FIP is working in that direction on multiple fronts, training the pharmacist, parallelly advocating with the government to promote pharmacists. But even before that, we can take up the role of advocacy, like how we are doing with Rainbow, with the support of nurses. So this can definitely be done.
Okay, thank you,
It
sir.
would be great to have this conversation offline so that, others get a chance. But I think, Komali, if you can coordinate a meeting between Dr. Raj, Dr. Karthik, myself, and some of you, I think that's the best way forward. So if you can get hold of
Okay.
the contact details, then,
Yes,
we
ma'am,
can take
sure.
this forward so others can ask questions. So we'll keep it brief so everybody has a chance rather than get into one question and all the details. Anybody else with comments or with other suggestions on what we can do together?
Ma'am, even on YouTube, we received feedback that it was a good session, a very nice session. And the same one, you can see it in our chat box as well.
Compliments
So,
are
ma'am,
nice.
like my takeaway is having all these teams together, ma'am, thanks to you. Education Division, Community Pharmacy Division, and Student Forum, Vikas College. 4 people going in 4 different directions. So, if we can come together, and especially the SF, which I was telling you always, these are the youngest, they have time, they have enthusiasm. And if they can be channeled in right direction, we can achieve many things. So, that's my takeaway. I'm happy to see SF actively participate.
Absolutely, can't agree more. So yeah, like Dr. Karthik says, I think this is the best takeaway. Komali, as a debrief and also as a preparation for tomorrow's one on AMR, climate change and emotions. That's also something that is new that is being tried. So please, this is also a good forum for you to tell them what is going on
Yes.
and why it would be nice to invest an hour in it, because it's something new we are trying with emotions. But most important, going forward and ending this session quickly, we are at 63 now participants,
Ma'am,
is to say, how do we take it forward? Yes, Komali, over to you.
yes, ma'am, we have a question from Dr. Venkata Rao, sir. He says, when can we get HPV vaccine in government hospitals?
From what I am aware of, it has been approved by the NITAC people. So the recommendation part of it is available. So even on the press release given by the Ministry of Health, the approval that it will be rolled out is available. But from what I have heard, it is still not out. So in the public sector. And even throughout the world, there's a lot of commotion happening in this area with respect to the HPV vaccine, because it has a lot of misinformation attached to it. But when it comes to the approval, yes, India has gone ahead with it, but the public sector, and they have to, keep it moving. So that's the response based on my awareness.
Thank you, ma'am. I think a student has messaged, ma'am, I think it would be great if neighboring colleges tie up together and set up vaccination awareness camps often. It would be really helpful to educate the public. Yes.
Absolutely. That's the way to go. When you do a pharmacy week, or you do a immunization week, or you look at, the neighboring colleges putting the full strength and working with the ASHA workers, with the Anganwadi workers, with the primary healthcare officers, and supporting these women who are doing an excellent job. You remove these 3 categories of women, half the national programs will fall flat on the face. These are the women who make it happen. And I work a lot with them, so I know the truth there. It's not just I heard it, so I know it. Because all my training in the last 3 years has been around these women. So if we can make it happen, it'll be great. So whoever has suggested Komali, you can just keep it as a placeholder and say,
Yes, ma'am.
okay, please, can we start getting a 2-line proposal to say how to do it, which college will do it, and how do we do it during the National Immunization Week or any other week, and then take it forward.
Yes. And ma'am, we can possibly open vaccination center in each small type of schools as well. Rekha,
That needs some permissions, right? Either a healthcare system has to do it, or pharmacists as vaccinators, technically that approval has to come in. Dr. Raj has to speak more about that, but we can be facilitators to make it happen. IPA and FIP have worked together to train some of the people. All of that can be used. Dr. Raj, over to you.
Ma'am, I think, yeah, he's there.
Any other comments, Komali, in 4 minutes? If we tell them in 4 minutes we are ending, maybe the comments will come faster. Otherwise, they'll think.
Wonderful session, great insights shared by all professionals. Looking forward for more such sessions.
Thank you. It was really nice that all professionals came together and all of us brought in that energy, which is wonderful.
Okay, if anyone has anything more to say, you can put it in chat box. We have 2 more minutes and then we can wrap it up. It was a truly insightful session indeed. Meanwhile, I'll quickly share the brochure. We have another session tomorrow, which is lined up for on the occasion of Antimicrobial Awareness Week. Yes. So it's again in collaboration with Indian IPA Education Division, Community Pharmacy Division, Students Forum, and Vikas Institute of Pharmaceutical Sciences. So it's a webinar on intersecting crisis, the emotional dimensions of antimicrobial resistance and climate change. And the session is being taken by the esteemed speakers. The resource persons would be Dr. Padmashri G.S., who is the emotion scientist and coach, and Professor Sunita ma'am, who is the Vice Chairperson of IPA CPD and Anti-Microbial Stewardship Program, Karuna Trust, and also visiting professor of Rhodes University, South Africa, consultant public health research, who's there right now addressing our questions on the current webinar as well. So we would encourage all the professionals and students to kindly join this session as well. It is scheduled at 7 o'clock in the evening tomorrow. So whoever's in the colleges, they can easily attend the session after their college gets over, and all the professionals are warmly welcome for the same. The meeting link and the YouTube live link will be shared shortly via all the channels that we have. Thank you so much. And I think we don't have any more questions or suggestions or anything on the chat box, ma'am. We can quickly wrap this up. And thank you so much, everyone. Dr. Raj Vaidya, sir, Dr. Sumalatha, ma'am, Dr. Karthik, Dr. Ambika, ma'am, Professor Sunita, ma'am. Thank you so much, everyone, for joining this session and sharing all your insights that you have learned, experienced, and shared here on this platform with us. And yes, thank you so much for all the participants who have attended. You are the platform, you are the audience that we are looking for, and for spreading this awareness as well as the potential of our profession that we can contribute for in this direction that of a vaccination. And please stay tuned for tomorrow's session on antimicrobial awareness, which is about the emotional dimension of antimicrobial resistance and climate change. Thank you so much, ma'am. We can wrap this.
Thanks, everyone. Have a good afternoon.